Hi, yesterday I was asked this question by two different patients. The question was, I have episodes that were diagnosed as seizure disorder, yet I had an MRI and EEG that were both normal. So how could they diagnose me with seizure disorder with a normal MRI and EEG? So to answer this question, let's talk about seizures. Seizures are typically divided into two main categories, primary seizures and secondary seizures. In primary seizures, the patient is born with the tendency to have seizures. The EEG and the MRI could be normal. In secondary seizures, there is something affecting the brain cells, pushing on them. It could be a mass, it could be a stroke, or it could be scar tissue. So typically, when patient is presenting with episodes that are suspicious for seizures or seizure-like activity, we order an MRI and EEG. The EEG helps us with the diagnosis and treatment, as it can show us particular patterns that help us diagnose the type of seizure the patient is having or choose the right medication for the patient. But EEG is a 50-50 chance it's going to be abnormal in patients. And typically, if it is normal, that gives us a good prognosis for the patient. An MRI also typically and in most patients is normal, and that gives us good prognosis. But if the MRI is abnormal, we can treat the abnormality if possible and also can give us prognosis for the seizures that the patient is having. So in general, the diagnosis of seizure disorder or seizures is based on the clinical picture, based on the episode that the patient is having, based on the judgment of the clinician and not the MRI or the EEG. The MRI and the EEG aid us with the diagnosis and help us with the prognosis. So just because you have a normal EEG, it does not mean that you don't have seizures or seizure disorder. However, you want the MRI and the EEG to be normal to have a good prognosis. And thank you.